Hi, I'm Dr. Devin Savage from Archlifter. Today, I want to explore the topic of spinal fusions. Spinal fusions have increased in the United States up to 700% since the year 2000, and there's little evidence that it consistently achieves its goal of pain relief. A surgeon can fuse the vertebrae successfully, but that does not necessarily equal pain relief. Further, the long-term failure rate of cervical fusions is very high. Up to 75% of surgeries fail to relieve symptoms. The spine is meant to be a segmented, flexible structure. Each segment is capable of movement, like this shower hose, for example. Spinal fusion surgery fuses two or more of the segments, like this. A spinal fusion is an interruption in the flexibility of the spine. It's quite clear from this advertisement from a spinal surgeon's office. Fusions are done for many reasons, especially for pain relief, but the effect is an interruption in the flexibility of the spine. Let's see what can happen with an interruption in the flexibility of a wire, for example. So what's actually happening here? The material is undergoing fatigue. At any given moment, one side of the wire is undergoing tension, while the other side is undergoing compression. In a material such as a wire being held with pliers, an edge is formed at the interface where the inflexible and flexible parts intersect. Stress cracks form, and stresses can concentrate in those cracks. They propagate and eventually may cause the wire to break. Dentists are well aware of the biomechanics of excessive stresses, and they call this phenomenon abfraction. Abfraction is very common in humans. It's usually caused by excessive clenching or bruxism, and it's even been found in mammoth teeth. Abfraction is different from tooth decay, and abfractions are not caused by decay, but by excessive mechanical stresses on the teeth. In a flexible material, the effects of this are quite similar to a bending wire or a tooth even. A familiar example of this can be seen in a typical MacBook charger. Right at the interface where the flexible and inflexible materials meet, an edge is formed where the stresses can concentrate, and eventually a crack can form. In material science, this is called a geometric discontinuity. With continuing movement, the resistance of the material is overcome, and the cracks can propagate and eventually cause breakdown of the integrity of the material. The spine needs to be both strong and flexible. In this example of a flexible material, a shower hose, there are no areas of stress concentration. During bending, the inner part of the bend becomes a tiny bit shorter, while the outer part becomes a tiny bit longer. Like a normal spine, there are no areas of stress concentration, and the integrity of the structure is conserved. Now let's do a little experiment. Just like a spinal fusion surgery, we can fuse a section together and simulate the mechanical effects of a spinal fusion. You can clearly see we have introduced a geometric discontinuity in the material that acts as a stress concentrator. This is essentially the effect that happens to the spine when a fusion is done. The spine segment both above and below the fusion levels experience this phenomenon. The spinal fusion hardware introduces a geometric discontinuity into the system and inadvertently causes an area of stress concentration. After a spinal fusion, it's common that the adjacent segments on both sides of the fusion hardware become painful and start to degenerate within a few years of the initial fusion surgery. This is commonly called adjacent segment disease, but now you know the mechanical engineering principles of why it should be actually expected after a spinal fusion. The good news here is that for most patients who suffer from degenerative disc disease, the discs can recover. Even heavily degenerated spinal discs contain living cells. There is mounting clinical evidence that these degenerated discs can improve if given the right conditions. However, spinal discs cannot regenerate if they are constantly in a compressed state. Spinal traction, especially balanced spinal traction, decompresses spinal nerves and opens up space in the spinal joints and in between the vertebrae so the discs can rehydrate and regenerate. To use balanced traction, start with a sensible amount of weight. Gently apply the traction force to decompress your spine, and then give your neck a good stretch and move back and forth, then side to side to increase flexibility. At Archlifter, we take a common sense, biomechanical approach to the treatment of neck and back pain. We understand that the human body has a built-in ability to heal itself given the right conditions. We also believe that spinal surgery for most degenerative conditions should be considered only as a last resort, and that most people who suffer from degenerative spinal conditions owe it to themselves to give balanced traction a chance to work wonders for their neck and back.